Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good evening to our dearest lecturer, Dr. Zulkarnain, and my fellow friends. First of all, I'm gonna introduce ourselves. My name is Ilham Hakim bin Abdul Karim, and alongside my friends are Muhammad Muhammad bin Ramli, Nur Fatini Izzati binti Azhar, Muhammad Afiq bin Jafri, and Ayman Hakim bin Zulkifli. We are from group spine, and today we're gonna talk about musculoskeletal condition of spinal. First, I'm gonna talk about the anatomy of spine injury. In humans, there are a series of 33 bones that run within the vertebral column from the base of the skull to the coccyx. The column divided into 5 different vertebral structures. First, cervical. Secondly, thoracic. Third, lumbar. Next, sacrum, and last one is coccyx. And there are 4 main functions of the vertebra. First, for protection, which is enclose and protect the spinal cord within the spinal canal. Secondly, to support, which means carries the weight of the body above the pelvis. Next, axis, form the central axis of the body. And last one, the function of vertebra is for movement. It has roles in both posture and movement. Next, the classification of vertebra. First, cervical vertebra. The vertebral column starts with the cervical vertebra. There are 7 of these, and they are numbered C1 through C7. C1 is also known as the atlas, while C2 is the axis. Second, thoracic vertebra. The thoracic vertebra are the next 12 vertebra, moving down the body. They articulate with the ribs, helping to protect the chest cavity containing the heart and lungs. The third one, lumbar vertebra. The next 5 vertebra are the lumbar vertebra, and these are the largest of the vertebra. They support the greatest weight of the vertebra and allow for flexion, extension, and side bending. Next, sacrum. Sacrum is a collection of 5 fused vertebrae, and it's also described as an inverted triangle with the apex pointing inferiorly. And the last one is coccyx. Coccyx is a small bone which articulates with the apex of the sacrum, and also known as tailbone.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Afiq bin Jafri. So today I'm going to explain about common sport related to spine injury. Okay, first of all is cervical stages. Okay, it is injury that when the head or neck is hit to one side. Okay, it also cause the shoulder to be pulled in the opposite direction. Okay, the second one is vertebral stress fracture. It is when the body block or vertebral body in the spine collapse. Okay, it can lead to severe pain, deformity, and loss of height. Okay, the third one is lower back strain and sprain. This cause when the muscle fiber are abdominally stretch. Okay, for sprain, it cause when ligament, the tough band of tissue that hold bone together, are torn from their attachment. Most of these result from a sudden injury or from gradual overuse. Okay, and the last one is herniated disc. Okay, it is a fragment of the disc nucleus that is pushed out of the annulus into the spinal canal through a tear or rupture in the annulus. Okay, discs that become herniated usually are in a early stage of degeneration. Okay, for the next one is mechanism of spine injury. First of all is flexion injury. This is the common spinal injury. For example, you got heavy blow across the shoulder by a heavy object. Other than that, fall from height on the heel or buttocks. Okay. The second one is extension injury. Extension injury is commonly seen in the cervical spine. Okay. For example, motor vehicle accident. The forehead striking against the windscreen, forcing the neck into hyperextension. Okay, this injury result in a hip fracture of the anterior rim of the vertebra. Okay, the third one is axial loading. Okay, most of the cervical spinal cord injury are the result of axial loading. It forces the head into hyperflexion and rotation. This type of mechanism maybe can result in a fracture of dislocation of one or more cervical vertebra. Okay, for the last one is rotation. Okay, rotation is a basic spinal movement in which you turn the spinal column. When you twist your spine, it will also bend to the side. Okay, what causes of rotate spine? A rotate vertebra or twist spine can result from spine, nerve or muscle disease, or harmful movement. Yeah, that's all from me. Thank you.
Hello and Assalamualaikum sir. My name is Muhammad Muhammad bin Ramli and today I'm going to show or share sir three of from the 6 type of special tests for spine. The test that I will be showing is Sperling test, Lermite sign, and Scober test. Let's go. Okay. Assalamualaikum. Today I'm going to show you how to do a Sperling test. Sperling test is a very simple test that is to assess the nerve root pain for your body. First, the Sperling test is very simple. First, you tilt the head of your patient body to the affected area, whether it's a right or left. After you tilt the head and compress the head downward to assess the pain. If the patient is positive of having back pain, having a problem with their cervical area, meaning that their side, which the affected side, will have a radiating pain. That is how you do a Sperling test. Okay, for the next test, we have Lermite sign or called Lermite phenomena. This test is a very simple. Which is when you're flexing the head of your patient, whether if left to right, and moving the neck, the patient will feel an electrified shock toward their body, which is radiating from the spine toward their arms, to the legs, and sometimes toward the trunks. If the patient show or tell they have this kind of response, means that they are positive of having a problem in their cervical spine. Last test for us today, we have Scober test to assess the cervical spine flexion for a patient who's suffering from ankylosing spondylitis. The test is very simple. First, mark the at the athlete body, which is 5 meter, and then 10 meter, which means all of it is a 15 centimeter. Then let the athlete bend. Now calculate the distance of the mark and compare the difference between the 15 centimeter to see how severe, mild or normal the problem, the difference is. You may refer to the table to see how the thing is calculated. Thank you.
That is all from me, sir. As for the other 3 tests, my friend Aiman will cover the rest.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Aiman Hakim Zulkifli and I'm from RSR 2433B. Now I will take over from Muhaimin and I will explain the remaining 3 special tests that are often performed to assist in diagnosing the musculoskeletal injuries. Let's go. Cervical compression test. This test is almost similar with Spurling test, which Muhaimin explained to us. But this test is used when client cannot rotate or extend their head. So the first step is make sure the patient sit with neck in neutral position. And then therapist stands behind the patient and using either 1 or 2 hands, it doesn't matter, carefully applies downward pressure on patient head. Cervical compression test positive sign. Radiating pain or other neurological sign on the same side of the arm. And dockless discomfort in the neck and shoulder. For payment test, the first step is make sure the patient lying down in supine position and therapist beside the patient. Cross the test leg over the other leg above the knee. Make sure that the ankle in free and not supinating. Press the flexed knee and the opposite anterior superior iliac crest gently downward. Favorite test positive sign. When the test leg remains above the opposite leg, this may be indicative to a problem with sacroiliac joint or hip joint. For example, when you are having a pain in the sacroiliac area, it indicates a problem with the sacroiliac joints. And this test is suggestive but not confirmative. The next and the last test is bowstring test. So for the bowstring test, the first step is to flex the patient's leg until pain is reproduced. And then slightly bend the knee for about 20 degrees in attempt to reduce pain. The last step is to apply pressure to the popliteal fossa, which is the area behind the knee. Positive sign for the bowstring test and our last test is painful radicular reproduction following popliteal compression, indicates tension on the sciatic nerves. That's all for the procedure. Now we will move to the next point, which is do and don'ts, which will be presented by the next presenter, Nur Fatini.
Thank you, Aiman. Hi, Assalamualaikum. My name is Nur Fatini Izzati binti Azhar, and today I'm going to present about do and don'ts. First, for do's. Do regular stretching exercise. This stretching exercise can help you to reduce the pain. Number 2, get chiropractic massage on a regular basis. Chiropractic massage is the best massage you can do for your back. The doctor will take tests on your back and take a look at your back to see unusual function that might be a part of injury. It helps you to get your feet back. Number 3, keep an eye on your posture. A good posture can avoid you from injury, from having a back pain. Number 4, sleep on your side if possible. Put a pillow between your knees to give support. Number 5, ice should be used. As we know, ice can help us to reduce the pain. So if you feel twist, you have to get an ice pack as soon as possible and put it in the affected area. For don'ts, certain workouts should be avoided since they might aggravate your discomfort. You should avoid exercise like running, lifting weight, and sit up because it can cause you back pain. Number 2, sitting for lengthy periods of time is not recommended. While you are sitting down, your lower can bring disaster on your neck. While you play phone, you have a take break for a while and do stretching at least every 30 minutes. Number 3, do not stare down for long periods of time. Okay, you have to move your body every 50 to 20 minutes to prevent yourself from injury. Number 4, avoid sleeping on your stomach because this can make your back pain turn worse. Why? The position will put a lot of pressure on your neck and cause constant head and neck pain. Number 5, carry heavy objects only when absolutely necessary, especially when you carry a backpack, okay, such as backpack, since it can also cause you back pain. So try to avoid carry large or huge objects too often, heavy object too often. The last one is the conclusion. There are a variety of factors that can influence how a spinal cord injury develops. So when the spinal cord is damaged, the brain is unable to connect with it correctly, impairing sensation and movement. So if quadriplegia and paraplegia is not managed properly, severe complications might occur. You might be hurt. So exercise is the most effective way, as you guys know, to approach for most people with spinal cord injuries to enhance their health and capacity to exercise on a daily basis. Thank you. That's all from me.